We don't want this to be a talking session. We've called it a discovery event, and that's because we want you to discover more about what the YHAHSN plans are, but also because we want to discover your ideas and also what your problems are, so that you can help us to shape the future for the YHAHSN.
Well, an YHAHSN is a collaboration of partners from both health organisations, universities, industry and training and education. In particular, I think it's important that for the first time we'll be bringing all these partners together to work on problems, to help us solve problems, and also to ensure that we have the right capacity in our workforce to deliver the kind of transformation of healthcare that we require over the coming years.
It's about knowledge integration. It's about bringing people together who have different learning, different thinking, have solved other problems, and the whole benefiting from the combination of skills, knowledge, creativity, wisdom, understanding of the parts coming together. Well, firstly, there's a duty for the NHS to get involved in the innovation, health and wealth. Every healthcare organisation has to be aligned to an academic health science network. But I guess the question would be, why would you not want to? You know, we're all here for the good of patients. We're all here to try and improve the outcomes that our health and population need. We're here to plan for the future. We're also here to deliver better care for today. So every healthcare organisation, be they a commissioner, be they an ambulance trust, be they a big acute provider, a small acute provider, a mental health trust, we all have a duty to try and find out the very cutting edge learning, technology, innovation, to create new partnerships with some of our private institutions that do things differently. It's incumbent upon us all to get the very best outcomes, and that's why you'd want to get involved.
And through the Academic Health Science Network, I think we have a real opportunity to be able to translate and broadcast where those pockets of evidence have been robustly developed and also been implemented into primary and secondary care for benefit for NHS patients. So that's what we're about, really.
I think it's a really exciting opportunity for academics to be involved in thinking about how they can get their evidence out there into practice more quickly, and the way to do that is to work more closely with people within the health service and other contributors to healthcare like industry, like third sector. And so I think for academics this is a great opportunity for them really to be at the cutting edge of having an impact with the research that they do.
So these are the principles that are going to be at the core of the way that we work with partner organisations across the region. We're not going to do things to organisations, we're not going to enforce things, we're going to be about co-designing, Yvette mentioned earlier, partnering and collaboration. We will draw on available academic evidence and data from the region.
I think there's two things it can do from a CCG perspective. I think it can encourage us as clinical commissioners to commission better. I think also clinical commissioners are primary care providers as well, and clearly primary care is an integral part of the system, and therefore there is something about finding platforms for primary care as providers to contribute, but also to learn and adopt the best practice and what works elsewhere equally.
But it's not just about invention and supply, it's also about adoption. We've got some really good technologies that are in place in one or two areas. Rebecca talked about IOFM, for example. We've got technology that's in place, but it's only in place in one or two organisations. So there's something about creating and supplying, but there's also something about adoption and spread.
Well, the relationship should be one of partnership, of actually finding mutual objectives to work together, to work forwards to improving patient outcomes. The YHAHSN has been established to improve patient outcomes across a population and to pick up on particular issues of spreading innovation.
The partnership can actually be at any stage of that pathway. Going back to Dawn's slide, it can actually be supporting academia to bring the innovation into clinical practice.
So they're organised through a lead NHS organisation working with other local organisations and all of the local universities in the area.
In particular, the question is, what mechanisms do you have to involve the local consultations and local input into this new park, because it will be very relevant, as we know a lot.
This is not an SHA manqué, as one of my colleagues described it. This is your network, and this is about us taking charge of the health system in Yorkshire and Humber and transforming it.
And the YHAHSN is therefore a very practical entity. It's designed to drive service improvement, and it's our network. This isn't about external diktat, it's about us working together to drive improvements in the service.